Hi, everyone. Welcome back to another episode of Ask Dr. Nick. My name is Dr. Nick Schmidlkoffer, and I work for the Neurologic Wellness Institute here in downtown Chicago. On today's episode, we are going to answer the question of, is eye-neck coordination important for treating chronic neck pain? And the moral of the story, or the quick short version, is yes, it is. And there's a lot of reasons why. The eyes and the neck work very well together. And when we have neck pain that becomes chronic, so after 3 months, it changes how the brain interconnects the proprioception from the neck and the proprioception from the eyes, and then also the visual system from the eyes. And how that interconnects can get changed and rewired and altered, and that can lead to further neck pain. And so what happens is we need to pair the two. We need to interconnect the two and work on them maybe individually and then together in order to rehab the neck. This is especially important after whiplash injuries, after concussions, after just very, very chronic neck pain, in order to desensitize the nervous system, in order to improve how the brain feels the necking space, and therefore we can improve outcomes. And so I want to just share one paper that is a very good randomized controlled trial on this. This article is from 2020, so this year, from 2020, and it is the effectiveness of an eye-cervical re-education program in chronic neck pain, a randomized clinical trial. And so just looking at the objectives, proprioceptive training is a popular applied therapeutic exercise in PT, in physical therapy. So this study was looking at the effectiveness of proprioceptive therapy using the eye-cervical or eye-neck re-education program to decrease pain and increase joint range of motion in chronic neck pain patients. So it wasn't blinded because patients knew if they were getting this proprioceptive therapy or not. But 44 people were, I should say it wasn't blinded to the patients, but it was blinded to the assessor who was assessing joint range of motion and pain. And so there were 44 patients. 22 were in a group that just had multimodal physical therapy intervention, which I'll explain later. And the other group had that multimodal physical therapy intervention plus the exercise program that included the eye-cervical proprioception. And so they were looking at pain pressure thresholds or trigger points in the trapezius, the levator scap, the splenius capitis, different muscles in the neck, and then cervical range of motion. And so what they found was that the proprioception treatment was effective in reducing the pain pressure threshold for the trapezius on the right and the left, the right levator scap, the left splenius capitis. There also increased joint range of motion that was statistically significant as well. So they concluded that this eye-cervical re-education program is effective at relieving pain pressure thresholds in these neck regions, and especially effective for increasing the cervical range of motion. And so all of this is great news because chronic pain is pretty detrimental to our society, going up to $150 billion in the U.S. for just chronic neck pain. And so we really want to be able to fix these, especially chronic neck pain that could be caused from previous concussions or whiplash injuries. And so I want to go right down into what the patients were. So the patients, both sexes, ages 20 to 50 years old, they had neck pain that was at least greater than 3 months, and they had active or non-active trigger points in the muscles. What the control group did, so all patients, control group had just this, but all patients were delivered to this multimodal physical therapy intervention. It consisted of thermal therapy, therapeutic massage, the application of analgesic currents, so like TENS unit, and that was it, right? Okay, so these And then the intervention group had the specific eye-cervical rehab. So we know that it works. Well, what did they do? And so we're just going to talk about the different things. So they said there were 10 exercises of the proprioceptive retraining cervical area in multiple phases. And so these phases started with like slow and eventually got more and more complex. And so the first phase, exercise 1, was in a supine position, so laying on their back, and they just activated the eye muscles, going left and right, up and down. And so this is basically ocular training or vision training. Then the therapist specifically turned their head passively while the patient looked at a dot who was fixated. But did both of these eyes open and eyes closed. Then we went from more just eye rehab and then a vestibular ocular rehab by moving the head to specific exercises where we're moving the neck but maybe keeping the head still. And so the patient was on a rotating stool, and what happened was the patient was instructed to keep their head straight and to turn their whole body to the left and then to the right, but keeping the head and neck straight and keeping their eyes on that target. Then a global exercise was done, which basically meant that the patient had to follow a path that was on the wall with their eyes and head on the same target. So like if I'm looking at my thumb here, my thumb is moving, we are following it all together. But instead it was just they were trying to do that on a pattern, whether that's like a butterfly pattern or a figure 8 or an infinity sign, something like that. And there was mobility work, which the patient had the gaze on the target on the wall, and then we destabilized the trunk. So basically what happened is the therapist specifically moved the trunk side to side, or if sitting on like a ball or like a therapy ball where it would cause this movement, we had to stabilize our head and neck. And then a head repositioning exercise. So after memorizing the position of straight ahead, the patient had to close their eyes, and then without opening their eyes, the patient had to return from a position that the therapist put them in. So for instance, closing their eyes, remembering this position, therapist would move the head, and the patient needed to move it back to the center and make sure that they're on target. In our clinic, we use this with a laser on a target. It makes it really, really easy for them to get, for the patient to get visual feedback of like, oh, hey, I was right or I was wrong, right? And that's how we do also the following the pattern as well. Then there was the head repositioning exercise the first one was the patient moved their head. The second one was that the therapist moved the head and then had to put it back under neutral. And lastly, we did more eye-neck coordination exercises without like restricting vision. And so free coordination exercises where the patient fixed the eyes on an object that was then moved in different amplitudes and range of motions. This was like manual resistance. So having to move to one side with resistance. So a little bit of strengthening and moving without it. And then a ocular cervical coordination was with multidirectional stimuli as well. And so while the patient had to move their head in different regions, the therapist maybe tried to move it back and forth and destabilize the neck doing this. And so these were the phases that were used in this study. And now what I want to mention is this works. This works for a lot of people going through these phases. But sometimes when you come into our clinic, we can only start at phase 1, and we have to take a little bit to move up the phases. Or we can jump right away into the phase 3 and go right to exercises 9 and 10. Everybody is different. Everybody deserves individualized treatment. At the same time, we might only turn your head to one side and back, or back, an extension, and then back to normal. We might just work on one area because that's where your diagnostic test, that's where our physical exam pointed us to work on. Rather than doing a global neck, head, eye recoordination training, you might need a specific individualized treatment. And so we like to use at our clinic a combination of all those things that we just talked about, some more than others based on what you can handle with your treatment. But we do use all of them all the time. It really just depends. And so I just wanted to emphasize that individualized treatment is great. And even though I just gave you a bunch of things that anybody can work on with chronic neck pain, there is sometimes more nuance to it. So if you have any questions, comments, concerns, please let me know, leave them below. If you have any suggestions for future topics, I would love to hear them. Otherwise, I hope you enjoyed this video. I hope you enjoyed the topic, and stay healthy. Thanks.